Good evening, guys. I have discussion D for you. The title is the age-old problem of long-term care by Peter Dzikes. Global aging and long-term care challenges. The world's the world is aging rapidly with a growing share of the population over 65, especially over 85. In the US, only 3 states currently have 20% of their population age 65, but by 2050, that number is projected to rise to 43 states. MIT economic Jonathan Gruber equips America's becoming Florida. America is becoming Florida, highlighting the demographic shift. New book, Long-Term Care Around the World. Edited by Jonathan Gruber, MIT, and Kathleen McGregory, Storybook University. Published by University of Chicago Press. Examines long-term care systems in 10 wealthy countries, comparing approaches and outcomes. U.S. focus. Informal care dominance. About 1/3 of elderly long-term care in the U.S. is informal, provided by family and friends. Despite limited time and resources, families shoulder a significant burden. Long-term care accounts for roughly 2% of U.S. GDP. Broader implications. The book underscores the need for sustainable, equitable care models as aging accelerates globally. It invites policymakers to rethink how care is structured, funded, and supported across cultures. If you'd like, I can help you compare these international models or explore how they might inform culturally responsive frameworks for marginalized communities. Right up your alley. Here are the key arguments made by Peter Dzikes in the article, The Age-Old Problem of Long-Term Care. Long-term care is a growing global challenge. Aging populations are expanding rapidly worldwide, especially those over 85. This demographic shift intensifies the demand for long term care, straining existing systems. Informal care is crucial but overburdened. In the US, about 1 in 3 elderly long term care is informal, provided by family and friends. Families often lack time, resources, and support, yet they carry a significant share of the caregiving load. Economic impact is substantial. Long term care recipients represents roughly 2% of US GDP, underscoring its economic weight. The financial and emotional toll on caregivers is often under recognized in policy discussions. Comparative global models offer insight. The book Long Term Care Around the World, edited by MIT economist Jonathan Gruber and Kathleen McCary, compares systems in 10 wealthy countries. These international models reveal diverse approaches to funding, access, and caregiving support. Policy innovations is urgently needed. The author emphasizes the need for sustainable, equitable care models. As aging accelerates, governments must rethink how care is structured. Supported and integrated into broader health and social systems. If you'd like, I can help you map these arguments into culturally responsive strategies or explore how they align with participatory frameworks for marginalized aging populations. Here are concrete examples from the article that support each of the key arguments about long term care. Global aging is accelerating. Example: Jonathan Gruber notes America is becoming Florida, referring to the demographic shift where more states will have 20% of their population age 65, rising from 3 states today to 43 by 2050. This illustrates how aging is not just a local issue, but a sweeping national and global trend. Informal care is a major pillar in the US. Example: Gruber and McQuarrie highlight that about one third of long-term care for the elderly in the U.S. is informal, provided by family and friends. This underscores the reliance on unpaid caregivers, often without adequate support or resources. Long-term care has significant economic impact. Example, the article states that long-term care accounts for 2% of the US GDP. This quantifies the scale of the issue and its implications for national budgets and policy planning. For international models offer valuable lessons. Example, the book Long-Term Care Around the World compares systems in 10 wealthy countries, showing varied approaches to care delivery, funding, and caregiving support. This comparative lens invites policymakers to learn from global best practices. Policy innovation is urgently needed. Example, the article emphasizes that as populations age and informal care becomes unsustainable, governments must rethink how care is structured and supported. This calls for systematic reform, especially in how we value and resource caregiving. If you'd like, I can help map these examples into culturally responsive strategies or explore how they might inform toolkit development for marginalized aging populations. Want to co-design a framework that integrates these insights based on the article's structure and depth. Here's a breakdown of which arguments are well supported and which could benefit from additional examples or elaboration. Well supported arguments. Global aging is accelerating. Support clear demographic data. And Gruber's quote, America is becoming Florida, illustrates the aging trend in the US and globally. Informal care is a major pillar in the US. Support the statistics that 1/3 of U.S. elderly care is informal, provided by family and friends, is compelling. Long-term care has significant economic impact. Support. Then the mention that long-term care accounts for 2% of the U.S. GDP provides a concrete economic anchor. Arguments that need more examples. International models often offer valuable lessons. Gap. Well, the article mentions that the book compares 10 wealthy countries. It doesn't detail any specific country's approach, innovations, or outcomes. Suggestion. Examples from countries like Japan, aging in place models, the Netherlands, dementia villages, or Sweden's publicity funded elder care would enrich this argument. Policy innovation is urgently needed. Gap. The article calls for rethinking care structures but doesn't offer examples of successful reforms or pilot programs. Suggestion. Case studies of policy shifts, such as Medicaid's expansion for home based care or caregiver tax credits, would strengthen the urgency and feasibility of reform. Would you like to co-create a comparative matrix of international models or explore how these gaps could inform culturally responsive toolkit development for marginalized communities? I think your myth busting and participatory design lens could really elevate this conversation. Given your focus on culturally responsive frameworks and participatory design, here are several international long-term care models worth including. Each offer distinct lessons for equity, sustainability, and caregiver support. Japan, aging in place and community integration model. Universal long-term care insurance since 2000. Features covers home-based and institutional care, emphasizes aging in place through community support centers. Why it matters. Japan's approach balances clinical care with social infrastructure, ideal for rural aging and intergenerational engagement. Netherlands, dementia villages and autonomy model. Hoganway Dementia Village in Weep features residents live in small households with trained staff, maintaining routines and autonomy. Why it matters. This model reimagines care environments to preserve dignity and reduce stigma, perfect for myth busting and life review toolkits. Germany, cash for care and family support model. LTC insurance includes cash benefits for informal caregivers. Features: family can choose between professional services or direct financial support. Why it matters: supports caregiver autonomy and acknowledges informal labor, aligns with your interest in measuring cultural adaptation effectiveness. Sweden publicity publicly funded elder care model. Uh, Municipalities provide comprehensive elder care funded through taxes. Features: strong emphasis on equity across or access and professional workforce. Why it matters: offers a scalable rights based approach to care, ideal for policy translation and infrastructure mapping. South Korea, rapid LTC expansion and cultural sensitivity model. LTCI introduced in 2008, rapidly scaled. Features include cultural training for caregivers and supports uh, file file pity norms. Why it matters: demonstrates how to integrate traditional values with modern systems, useful for cross-cultural adaptation. Would you like to co-design a comprehensive matrix or implementation guide using these models? We could map them to US gaps and explore how these how they how they uh, inform toolkits development for marginalized communities. Excellent question. Each of the international models I mentioned earlier tackles equity in elder care through distinct mechanisms, some structural, some cultural, and others financial. Here's a breakdown of how they do it. Japan, universal access, community-based support, equity strategy. Long-term care insurance is universal regardless of income or family status. How it works: everyone over 40 pays into the system and becomes eligible for services at age 65. Equity impact reduces disparities by ensuring access to care across societal economic groups, especially in rural areas, through community care hubs. Netherlands, person centered dementia care. Equity strategy. Dementia villages like Hugaways often tailor environments that preserve autonomy and dignity. How it works: residents live in culturally familiar households with staff trained to support their lifestyle and preferences. Impact. Equity impact addresses cognitive health stigma and promotes inclusion for people with advanced dementia, especially those marginalized by conventional care models. Germany, cash for care, flexible benefits. Equity strategies. Families can choose between formal services or direct cash payments to support informal caregiving. Okay, guys, so that is it for the night. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.